Did you know stress, physical or mental illness, your living, sleeping arrangements, family history, if you are a shift worker, you're working those overnight hours, those off hours, and of course, what we eat and how often we move can all contribute to insomnia. So, sleep, how important is it? That's going to be our topic tonight. And of course, we're not just talking about how you can catch some Z's. The biggest part of this conversation is how does lack of sleep, or we could just call it poor sleep hygiene, how does it impact our overall health? And of course, in our conversations, as we dive into what's most important to all of us on this call, is doing the best that we can to prevent or delay the onset of type 2 diabetes. What is the connection? So we're going to dive right in. And in our conversation, I'll share the participant manual here. Do you get enough sleep? Why does it matter? What are some strategies to get more rest? And you know what I'll say? What if you have the best bedtime routine? You don't struggle with sleep. You rarely ever have times where you toss and turn. Then, of course, that is awesome. So then what's in it for you in this conversation? Well, of course, although it may appear that this might not apply because you have perfected sleep, think about how it can easily be applied when you reach that point in your sleep habits where things may not be going as planned. And then secondly, isn't this something we could share with someone else? How often do we have conversations with those closest to us and the topic of sleep or the lack thereof comes up? So we'll talk about how we can get into a routine to help us get better sleep, but also real talk is what are some of the challenges that we deal with? Because not every situation or cause for insomnia, we saw that in the post, is something that we may be able to control right away. It really could be a work in progress. But let's make the connection first to diabetes and sleep. So, studies show that when we don't get enough sleep, then our insulin doesn't work well, which means your body doesn't process fat as well. And then let's talk about the brain having trouble as well, remembering things, because you haven't had enough to eat. It doesn't know. It's not able to get those sensors, right? The neurons aren't processing information properly. In other words, the system is just jacked up a bit. And where does it start, according to this conversation? What sleep can affect. So according to the American Academy of Sleep Medicine and Sleep Research, it recommends that we get at least 7 hours of sleep per night. And when we say 7 hours, right, not 7 hours on and off, we're talking a straight 7 hours of sleep. And we want to dig into this. But when we look at what's so interesting, let's look at some of these complications. What happens if I get less than 7 hours of sleep? I mean, and can we not recall maybe earlier in life where you could stay up all night, sleep for 3 or 4 hours, get up and go to work and function? Well, I know that all of us on this call definitely looks at sleep as a luxury and something that we want to definitely enjoy. That the idea of staying up most of the night and only getting a few hours of sleep does not make us feel great. And as a matter of fact, what happens when we get less sleep? Feel free to chime in the chat as well. This is all found in your participant manual, but we're going to go through these because, how many of us on a scale from 1 to 10, and you can give me a reaction, you can put it in the chat. How many of us are challenged some nights to get a straight 7 hours of sleep? Now, if you're getting up at 3, 4 o'clock in the morning, because you got to go make a deposit, then go back to sleep, fine, especially if you're getting up and you're going right back to sleep. But if you are challenged to get, these 7 hours straight, I'm telling you, ladies, it will change your life. Yesterday, I had one of those days that I must have needed. I'm not saying get 12 hours of sleep, but that's what I got. And it felt amazing. Every once in a while, I'm able to get those 12 hours of sleep. So I took a nap that turned out to be one of those naps. What was it? Maybe 3:30, 4 o'clock in the afternoon. I didn't wake up till 10 p.m. Got up. Yeah, I ate. I had a meal after 10 o'clock. And guess what? I went right back to sleep. I was back to bed by 11. Slept until like 5:45. And I woke up refreshed. So I'm not talking about aim to get those 12 hours every opportunity you get. But you know what? When a body says rest, and you position it to rest, and that's what I did when I said, guess what? 4 o'clock, I'm taking me a nap. My body said, guess what? You need more than a nap. You really need, you need to lay down and allow your body to turn off and rest. And I tell you, Monday felt magnificent waking up. Well, for those of you joining, you have not missed much at all. We are talking about why sleep matters. And in the chat, I asked the question, have you faced or are you facing a challenge with sleep? So one or two things. If you're not challenged, you're able to get those 7 hours of sleep. Or maybe you feel like, you know what, 5 hours work for me. I get about 5 hours, I'm good. Well, how could you step it up to 7? If you have perfected sleep and you're getting those 7 hours of sleep, we want to hear a tip in the chat. But we talked about complications. What happens when we don't get enough sleep, and how does it affect delaying type 2 diabetes or diabetes? Actually, if you don't get enough sleep, your insulin does not work. We know the phrase insulin resistance. Insulin resistance occurs before we even reach a prediabetes state. But then your body also does not process fat as well. And why is fat not processed well when we don't get enough sleep? Interestingly, that brain of ours has trouble transmitting that communication about where we are in terms of food. So it doesn't know if we've gotten enough to eat. So that system is all over the place. So let's talk about some of these complications. You can tell it's one of my favorite topics. If you don't get a regular 7 hours of sleep each night, we talked about insulin resistance. Insulin resistance leads to prediabetes and ultimately type 2 diabetes. It can make you hungrier than you are, and then begin to suppress that appetite. So notice this. It will make you hungrier the next day, but reduce how you feel after you eat. Can we see that connection to suppression, right? Like, I don't eat breakfast. I'm not saying I don't. I try to eat it on a little something. But if you are that person, you don't eat breakfast, maybe you're just having that cup of coffee and you don't eat till maybe 1 o'clock, 12 o'clock, 1 o'clock. The question becomes, are you getting really good sleep? It will make you more likely to eat these junk foods. And why? Again, the brain and how it is processing your new food regimen. These foods you will crave because when we don't get sleep, which helps the body to rest and generate natural energy, now what are we looking to boost our energy? We're having sugar without coffee. We're going ham on those less healthier carbs because we're trying to get some energy. It becomes harder to lose weight because the body system is not receptive to it, right? Remember, we said the brain isn't even picking up on those signals that we've eaten enough food. But check this one out. Lack of sleep can put us at a high risk for hypertension, high blood pressure. It will raise it. And we know that heart disease is real. And when we're unable to manage our blood pressure successfully, there is no doubt that we incur more issues with our heart health. When we don't get enough sleep, are we a fighter? Can we fight these illnesses from COVID to the flu? Yeah, we're going to talk about why you don't have problems sleeping 7 hours most nights, Miss Fan. You will get to share what you've been doing.
No,
We're gonna get to that. So our immune system, we want to treat it right. I'm going to call it a her. Everybody on this call is a woman. Our immune system, relate to her, comfort her, take care of her, because that immune system will help us to fight when we give it a chance to naturally rest. And ladies, let me tell you, this point, I could talk on this all day, as you can tell, because we're only on the second page of the participant manual. But how do you feel? We are in one of the seasons where seasonal affective disorder, that seasonal depression, is real. Many of us living at a time where we're dealing with so many challenges. They're like back to back, various challenges. But when we look at where we are from a mental health perspective, it's okay. And I'm not asking anybody to tell their business, tell their story. You don't even have to put this in a chat, but just something to think of. If we are fully aware of our emotional health, our overall well-being, can we make a connection to not feeling well mentally and emotionally and evaluate where we are with proper rest? I know I'm the type of person, sometimes if I'm not getting decent sleep or I'm not feeling well, I could oversleep. Not like the example of the 12 hours. I needed that, and that refreshes me. I'm in love with those opportunities. However, can you go back and assess where you are in terms of sleep? If we talked about how lack of sleep can cause the brain to miss signals in terms of food, then will the brain also miss other signals that relate to how we feel? So that increased risk of depression and anxiety, I'm not saying sleep is a cure-all, but sleep is definitely a bestie. Sleep is a friend. Now, we'll take a look at Jenny's story. She has part 1 and part 2. Of course, always see if you can relate. Is there anyone who would like to share Jenny's story, part 1? We'll answer a few questions. And then we'll dive into how we may be able to connect the dots for us. Crystal, awesome. Please feel free to chime in.
Crystal's fast.
So it says, Jenny is at risk for type 2 diabetes. At her last checkup, her doctor asked whether she gets at least 7 hours of sleep.
You might be on mute, Crystal.
I'm seeing.
Well, I can hear.
Can you hear me?
Uh-huh.
Can you hear me, Nick? No?
I can hear.
Okay.
Okay, we still can't hear you. It might
Oh.
be. Uh-oh. Are you able to see the screen?
Uh-huh. I can see it. Sometimes I'm not seeing. Can you hear me now?
Yeah, I'm still sharing the screen, but I think
No, I see it. I see the screen.
I'm using a lot of bandwidth here. Let me delete all of this that's going on. Okay, so here's what I'll do. Let me hop back into our story and I'll take a look at sorry ladies, this hopefully you can still see. I'm Going through the motions with this computer here, but here we go. Jenny is at risk for type 2 diabetes. At her last checkup, her doctor asked whether she gets at least 7 hours of sleep each night. And of course, she laughed and said, "Are you serious? If I'm lucky, I can get 5 hours." Jenny usually doesn't have much trouble falling asleep, but she often has to use the bathroom early in the morning. This gets her thinking about all the things she has to do for the day. Plus, her husband is breathing really loud. I call that snoring too. And both of those things make it hard for Jenny to fall back. So often she's right there just looking at that ceiling, staying awake for hours. How many of us can relate? And I asked this question already. Crystal, you have your hand up.
Oh, no, I was just answering your question. How many could relate? I was just saying I can.
Every time, and for some reason, oh, okay. I hope I'm not controlling the muting. Okay,
Hey.
there you go. Are you
Yeah, can you hear me now?
it could be your volume.
Right, let me turn my volume.
You might want to turn your volume up.
All right.
And feel free to use the chat as well.
Okay.
But
I hear 'em fine.
we talked a little bit about that first question. Right? How do you feel when you don't get enough sleep? And not just physically groggy, but mentally, how do you feel? And now, interestingly, this question, if you've ever been asked about a sleep habit at the doctor's, that's great. Most will not ask that question. But Jenny's doctor asked. And based on Jenny's response, clearly there are reasons why she is unable to get the sleep that she wants. We just talked about that. I mean, you're getting up in the middle of the night. That's fine. You got to go make the deposit. But once you lay back down in that bed, does your body signal you to go back to sleep? Jenny has a lot going on, so much so it's hard to get those things back out of her mind. The moment she wakes up to go to the restroom, her mind triggers right to the next few hours of the day, the start of that day, and what it's going to look like. And it doesn't help that laying right next to her is the man who probably needs a CPAP, who is driving her crazy because the sound of his breathing and probably his snoring as well makes it difficult for her to tune him out. Now, she's probably not having trouble falling asleep because she rushes to the bed to go to sleep before him. But if only she could avoid getting up in the middle of the night or finding another way to cope, at least until hubby gets a little help with his sleep hygiene, right? Because his breathing too loud is definitely an indication that there's something he may need to get checked out. But these are all normal things. So we're not bashing Jenny or the man. It's just the reality. So then what will she do? Because the one option should not be to continue in this state because of her risk factors for type 2 diabetes and the fact that we know she wants to live her best life, her best healthy life. So Jenny gets several suggestions from the doctor that could help her get better sleep. And she explained that getting enough sleep could help her manage her weight. So what's happening next? Jenny drinks less water close to bedtime. She avoids caffeine in the evening. She makes a list of things to do the next day. Then she sets it aside. She rarely needs to get up to use the bathroom during the night anymore. If she does wake up, she breathes deeply to help her get back to sleep instead of thinking about that to-do list. She also runs a fan to cover up the sound of her husband's breathing. So what is happening as a result of some of these small, zero cost suggestions? she's starting to get closer to those 7 hours a night. Simple steps. Let's run through them. And if you have any suggestions or a challenge you would like to overcome, right? There may be someone right on this call that may be dealing with the same concerns. How can we help address some of the things that we can control? And that's what I like about Jenny's part too. The focus here was what she could control within her environment. One thing she could do is look at drinking less water close to bedtime. Now, no doubt, whether you have prediabetes or type 2 diabetes, what is one of the symptoms? We drink. You feel so thirsty. You continue to drink. But if you drink enough water during the early part of the day and just sip a bit, but give yourself a cutoff time based on the time you go to sleep, that's what worked for Jenny. But she also realized that there was a possibility that her caffeine, whether that be in a form of coffee or a soda, that she became more aware. Hey, am I taking in caffeine maybe an hour, 2 hours before I go to bed? Could that also play a role? She did 2 physical things so far. But what did she do to help her mental? I know we caught that. She literally wrote down her list of things to do, then set it aside. That might sound too simple to work. But that physical thing, if you think back to childhood or even now, what type of learner are you? Are you a visual learner, right? Are you an audio learner? Are you someone who has to watch yourself, write it down and see it, right? She took this list, physically wrote out everything she needed to do so she could see it, and that put her at ease. Because now I don't have to just think about everything that I have to do, literally putting it down on paper, and it is proven this could help. But then she physically took that list and set it aside. It has its place. And now it's no longer running up here because I planned out my day. So I don't have to worry about that. Could we do that? That's more of a mental and emotional tip. Let me get this out my mind on paper, run through it, read it out loud, whatever I have to do, but I'm going to put it aside psychologically. It helped. Her husband is going to continue to breathe deeply until he gets that CPAP machine or until he goes and finds out what is causing him to do that. Maybe even deciding to join her healthy mission and drop a few pounds too could be helpful. But she can't stop that man from breathing heavy like what he's doing. So you can't beat him, join him. She found a sound solution to drown him out. I probably would have found music or a white noise machine to help lull me to sleep. And we're going to talk about that because those tips that her suggestions her doctor gave helped for her. I would love to see if you have any. Oh yeah, the dark, no TV, turning that cell phone off, right? Could we be what if we're waiting for somebody to call us to tell us something wrong? Our mind could work that way. Like we're just waiting just in case somebody has to call us. We got to turn that off. We don't have to turn the phone physically off, but we can definitely turn it to vibrate, turn it to do not disturb. It can be a challenge. So here are a few suggestions. And feel free in the chat if what Jenny did, if any of that worked for you. So if there's too much noise, we just had that. Ms. Van put that in a chat. when I brought up the white noise machine, if you're not familiar with white noise, there's white noise, brown noise, pink noise. It's just sounds. There are sounds that stimulate the brain waves to actually do more of a relax. And you can look up what noise might work best for you, but they're literally, you can find white noise actually in YouTube videos as well. It's not something you always have to pay for. Nature sounds are absolutely amazing. I'm actually going to share some before the end of this call. They could relax you. Last night, I mean, not that I needed it because I was going to get my sleep any old way, but we had the rain with the thunderstorms last night, and I'll tell you, it was the ultimate relax. Shut the doors and the windows. Tell people around you if there are people affecting that noise. I mean, we got to have some boundaries, especially if you have to get up and go to work. But we see how vital sleep is. Tell them be quiet. And, hopefully they listen. But this is really what Miss Van put in the chat. If it's too much light. Now, if you're someone who can do the darkness, that you don't need like that little night light or something going on, definitely not the TV, right? The TV could be a big distraction for some people. Or what if you're that person, maybe you need it on at first to go to sleep, but I hope it's on a timer or somebody's turning that thing off. Those room darkening blinds or shades, they work. I love the idea of a sleep mask. They could definitely help as well. And I mean, what if your bed is not comfortable or you're not comfortable? Is it anything else that you can do to the bed? Could investing in a pillow top, if it doesn't have to be the whole pillow top mattress, now they sell the pillow top, I want to call it a sheet, but it's more like a fitted sheet. If is the bed not firm enough, well, then now you can get another type of sheet to make the bed firm. We don't have to buy a whole new mattress. Trust me, they have things that you can temporarily change the function of the bed. Or do you need more of a pillow? I don't know about you, but sometimes I have to sleep in the craziest way. Yes, it's a mattress topper, and they have various mattress toppers based on your personal needs. Do you need it to be a firmer topper? Do you need it to have that cold technology? Do you need it to be a little more plush? Do you need a down-filled pillow topper? They have them. Do you need that whole body pillow because you have to lay a certain way? Maybe your hip or your knee, maybe your back. The way that you lay is making you feel uncomfortable. Find those positions that will ease the challenges so that you can actually get a good night's rest. That thirst we talked about. Set that timer. For those of us with children, you think about when especially during those potty training times and then early on pre-K elementary school, maybe even up to first or second grade, like, you're not drinking nothing up in here past 7:00. I'm not changing no bed sheets. I'm not doing it. So guess what? We got to go back to that. Because if getting up in the middle of the night is causing you to not be able to fall right back to sleep after, no matter what that reason could be, then that means we may need a personal cutoff. We need to set a boundary on that, just like Jenny did, and it helped. And like it says, if you're fighting thirst, that it can be one of the challenges. A big spill of that, we know that with thirst, it could simply be that we need to have more water, a choice of some healthier liquids throughout the earlier part of the day, because it can be a sign of dehydration. But we can sip just a little bit, right? Remember, there are no hard, fast rules. It's what works for you. You don't want to get up in the middle of the night. Same thing. We're going back to evaluating when that cutoff time is. And think about your alcohol content too, right? You get that glass of wine every day, right? 1 glass a day. You got to have a glass of Merlot at the end of a work day. Well, how close is that last sip to your bedtime? Because alcohol could keep you up as well. But look at this, ladies. We're going back to our emotional health, our emotional well-being. If we're feeling anxious, or we on high alert, right? Either way, it's too much. Our emotions are either taking us all the way down, it is zapping us totally, or they're taking us to the other extreme, right? We're just in this state of alertness. That's not cool either. But what are some things you can do first during the day? Routine is queen. It's something about a routine. So the schedule can help us reduce anxiety. I get up at the same time each day. Hopefully it is that time that allows that 7-hour sleep window, right? So that your body can become acclimated to this schedule, right? Because we know with the body, any changes it wants to fight naturally. Like, no, we've been doing this for 10 years. I'm not ready to change. Well, get that body on a schedule and aim to stay within those same time parameters so that the body can begin to ease. Remember, it's fighting a norm. We did that. We've given it this routine and now we're changing it. So we got to gradually get it ready for the change and not give up. This even says you might want to avoid caffeine. Now, it's not often that we say don't do something, right? Ultimately, it's up to you. But depending on the degree of your anxiety, you may want to have a caffeine-free day. Try the decaf coffee or beverage with no caffeine. Try decaf tea. If you smoke, quit. Avoid the late day naps like me and my 4 o'clock nap that lasted for 12 hours, right? Get some physical activity, move it along. We already know that movement will stimulate those endorphins so that we can get some of those happy hormones going. And physical activity doesn't have to be much. Put in a chat. Give me some examples of some physical activity. Literally go vacuum the rug. Go sweep the floor. Simple things. Take a walk in a house. Carefully walk up and down your steps. Or just walk up the last step twice. Like a step aerobics. Find a way to easily move that does not make you feel like you need to overexert yourself to reduce those feelings. But physical activity is one of those quick fixes. It can help. Managing stress, no doubt, that is really why I'm anxious. Okay, so tell me how to manage this stress. First, we have to identify what is causing the stress. And once I identified, is it something I can fix? Do I have control over it? Can I fix it right now at this moment? Is it something I can ping pong off to somebody else? Is it something that I can put in my back pocket for the day because there's nothing I can do about it today? I can't call who I may need to call because the office is closed. I won't be able to fix it until payday on Friday and it's Monday. Then why is it zapping all your energy on Monday? You figured out the solution, or at least to the best of your ability, what can happen and when. Do you have enough time to wait until Friday? And if you do, then you can back pocket it until Friday. And if not, find out who you can talk to help you get it done before Friday, right? So when we manage stress, yeah, those 2 words are so significant, but the reality is stress will never go away, only the degree and to what extent it can affect us. And if we are anxious and those anxious thoughts are caused by stress, then we just evaluate what those stresses are And again, how much of it can we reasonably control? And how reasonable is it to be able to push that aside, like almost just like that list that Jenny did? Because that to-do list was stressing her out. But guess what? There had to be things on that list that she could not do the next day. But she prioritized them. She wrote them down. And then she put it aside because there's nothing on that list she could do at that time but focus on sleep. Now, even deeper than that, insomnia can be caused by other reasons. And we talked about that in the beginning with our initial picture, that quote, what can cause it. So we may need to get a healthcare provider involved because we know the seriousness of what lack of sleep can do to our physical health and our mental health, because it puts us at higher risk for depression and anxiety. So talk to your healthcare provider and get their input. And remember the research. So I got to throw that in there too. Mm-hmm. If your healthcare provider has deemed it necessary to support you with a sleep aid and you are all on board for it, just remember to ask questions. Ask about the dosage. Ask what the minimum dosage is and what they recommend for you. And if more than a minimum has been recommended for you, ask them to explain why. And how deep are the, I'm saying consequences. That is not the word I'm looking for. The side effects that I should look out for as a result of this medication. Dig deep and find out about the medication and multiple medications, because maybe there are others. And in case that one sleep aid does not work for you, you should know what another option is so that you can do as much research as you can if there's a need for the doctor to revisit the prescription he's giving you. Remember, you are your best advocate. This talks about medications. What if a medication you are on is actually contributing to your insomnia? That's a conversation. Through self-awareness, can you pinpoint a time where you didn't have a problem with sleep? And now for the past 2-3 years, I'm having a problem sleeping. What has changed? It could be your medication. It may not always be circumstances or added anxiety. So this is where we become our best advocate. So again, we're going to continue this challenge. They break it down by times. Remember, I said this is in your right inside the hub. It's in the digital workbook. You could also consider just before bed, trying not to become stimulated with devices. And I'm going to tell you, this is something, even though I don't have a problem falling asleep, I can get antsy from time to time, sometimes at night, but I will tell you, these things are something else. And they are a stimulant. Look, mine almost glowing. If you look at it, it almost looks like it's like a glow. Because these things make the brain keep thinking even when you're not on it. Mm-hmm. It can truly be a distraction. And I'm preaching to the choir, so to speak. But just imagine if you're having trouble falling asleep, or the overstimulation, stimulation, almost similar to Jenny's situation where she gets up and can't turn it off. Sometimes these devices, or even the TV on too close to bedtime, can easily have the brain going. Only you know. Avoid working or being very active. What's your workout routine? Maybe for you personally, it may not be a good idea to do a workout past 7 p.m. if you're going to bed at 9. So you got to look at that, right? We want to get our exercise in, but remember, exercise boosts energy as well. For some, so we just look at that. Maybe I'm working out a little too late, and it's making it tough for me to be able to wind down. What things could we do to wind down? I would love to see it in the chat. They're going to give us a few tips, but remember I said I'm going to share one of those nature sounds to help us unwind a bit. Yeah. I find that when I wake up in the middle of the night, I need to check the time on my phone. Guess what happens if I check the time on my phone in the middle of the night? Going on Instagram. I just might check Facebook. I know I'm not going to lurk around indefinitely, but oh my goodness. And I guarantee you, I'm probably going to check one of my work emails. I'm probably going to see if just maybe 5 hours later, I got an email that can't wait till 9 a.m. How crazy is that? It's all psychological. But that's what happens the moment I pick this up. Good point. Look at this, y'all. Don't pressure yourself to fall asleep. Keep the clocks and watches out of sight so you don't think about time passing. So maybe this tip applies to you. Maybe you are so conscious about time that it actually causes anxiety and a pressure. I really like to know why my thumb is going up. Okay, let me put it down. Okay. So, and if you don't think you'll fall asleep right away, it's saying get out the bed and do something relaxing until you feel sleepy. Only you know what that is. I don't know if I'll say that cup of tea because I feel like if I had a cup of hot tea,
We'll run you to bed.
I'm positioning myself to get up at 2 or 3 o'clock to make a deposit.
Mm-hmm.
But what could you do relaxing? Could it be a stretch? Could it be turning down almost all the lights, maybe keeping on a very low light and put on some of that nature music or maybe even that white noise so that you're able to bring it down? Could it be breathe work? I'm a fan of 5 deep intentional breaths. Oh my goodness. They not only clear my mind, but it literally will put me in a state of rest. It gives my body that downtime that it needs. So let's take a look at this before we hop into some music. There it is. Now this says breathe deeply for 5 minutes. That's a nice long time. But what if you remember, what is your sleep regimen? What does it look like? Sleep is more than a hot shower, PJs, and covers and a blanket. What happens before that determines the quality of your sleep. And I know we'll all agree, right? I mean, if I had a rough day and I'm an exhausted day, for me, that really could mean that I could lay down in a bed and get a good 7 or 8 hours of sleep because I am that exhausted. But for someone else, that exhaustion could be so overwhelming and overstimulating that it makes it really difficult for another person to fall asleep because their mind is still in a wind-up space. Yes, we are going to listen to this music because I'm telling you, it's truly a calm. And if you've been to the spa, that's a practice for us. The music is there for a reason. Mm-hmm. It serves a purpose. This talks about drinking that warm milk or herbal tea. Again, just know if you're struggling in the middle of the night, but think about it. It could help. Here we go again with this part, Crystal. Yep. Avoid looking at the screens if we can because of stimulation. Let's get that music going. Get that list of things to do done and put aside, whether it's in your planner. Now, here's where we may have to go into the devices because if you have to, I know sometimes I just like to look at my schedule that's in here, but I need to figure out, okay, if I'm doing that, what's my time to look at that schedule and make sure everything is tight on that? I got an idea of what that next day looks like. How can I do that and try not to make that time too close to the time for me to go to bed so that one, I don't get lost again with the device. Start reading a book. I know for me, the moment I start reading, I don't care how enjoyable it is.
Mhm.
If I'm reading sitting up in the bed, I'm not going to last long, no matter how interesting. So it definitely, it definitely is one of those techniques I know I can use if I'm unable to fall asleep right away. The warm bath, warm shower, and maybe begin to write. I will tell you, same thing with reading and writing. Let me start writing something. I guarantee you, 3 sentences later, I'm done. Somebody gonna have to take the pen out my hand. I don't know. Reading and writing, I like them both, but at the end of the day, if it's at the end of the day, I'm not going to be able to get enough work done. But what works for you? And that is that question. You know, each week you have a focus. You have a focal point for the week. What will that focus be? If the focus for this week is going to be get better sleep, get more sleep, then here's the question. What will help you unwind at the end of the day? Why my screen almost looks like I decided to do blurry. Let me just make sure I don't have a because all of a sudden I got really blurry, and I don't know if you all can see that. Okay. Mm, maybe that is just the way it's going to be. All right. So let's oh yeah, not good. Okay. So let's hop into our as we get ready to wind down, but realistically, ladies, please, and feel free to share it in the chat if you'd like. What are some routines? What can you add to your sleep routine so that you are able to get better sleep? And even if you don't have a problem sleeping, right? Even if it is not a problem, if you think about what is one thing you can do for you? You know, one of my favorite phrases is self-care is not selfish. And let's look at self-care as a 24-hour thing. We certainly can. There is, I'm going to pull this up in just a moment, so I hope you all can hang out with me for a minute. This is one, and I hope it works. Let me see. Oh, no, not the one. All right, because this is going to give me a hard way to go. We're just going to share this here. So I hope you can hear it, that your sound is up pretty good. I'm going to get the sound right and play this so we can hear it. And that is not the one. It's just going to take a second and then we'll be able to. And it is really taking way too long. So I'm going going to listen to it through here because for some reason this is definitely the computer going off.
That's nice.
And this scene is so beautiful. It really is. Now, give me 1 second, ladies. The picture is what I was looking for, but the sound is not. You're able to hear the nature sounds and a waterfall if I could just get a reaction. There you go. I hope that worked because I'm really half asleep right about now. But those nature sounds are absolutely amazing. And on YouTube, they are free, right? The thunderstorms are among my favorites. But if you think about it, tonight's lesson, I hope there were quite a few takeaways for you. Just in a quick summary, 1, sleep is vital. Sleep is equally important to eating well and exercise. Sleep is how we take care of our overall health. And we've seen through studies and research that sleep affects insulin levels. Lack of sleep can result in insulin resistance, right? So when we're not getting that sleep, we are putting ourselves at a greater risk for diabetes, and our heart health is affected as well. Sleep definitely affects the weight loss journey in so many ways. 1, that lack of sleep makes it difficult for our brain to understand and connect if we have eaten enough food. So we're not getting the hunger cues correctly. We're not getting those cues that we have eaten enough. That lack of sleep can also cause us to give into cravings for food because we lack energy. So the body desires to crave this energy, and we are more likely to crave those unhealthier carbs, right? And so there's so many benefits to finding the time to take the time to aim to get those 7 hours. Remember, they would say 8 hours is amazing. This is saying if you just get 7 hours of uninterrupted sleep. Now, did you know if you have a Fitbit or an Apple Watch that you can connect your Fitbit or Apple Watch to the Practice Better app, and it will log your sleep if you keep your watch on. You literally can see the sleep activity, and that is absolutely amazing to see. You'll get to see the REM, which is that state of sleep that is so enjoyable. Wouldn't it be great to have 7 hours of REM? Yeah. You'll also see the light sleep, patterns. And for some of you, if you have, depending on the type of phone or health app, it does the same thing. But the beauty of it within Practice Better is that it calculates it, it breaks it down, and you literally can get a printout. You can actually download the printout. We've made it so you can pull all your analytics from the app. But let's make sleep happen. It was Miss Van. I wanted to pick on her for a second if you wanted to come off of mute or even chime in the chat, because she said, I gets my sleep.
Yeah, I make sure I get my sleep. And going to the spa, getting massages, all of that helps, because it helps get rid of that inflammation in your body. And that's a lot of time because of that pain that you can't sleep. So when you do those things, it helps. And now my problem is getting out of the bed
Yeah.
in the morning, because I sleep so good most nights and I don't want to get up. And so I just be sleeping. So, and that's what I've been doing.
That is awesome. And thank you for sharing. Yes, Miss Van does not mind. Her part of her self-care regimen is coming into the spa and enjoying some of those spa services, especially the sauna therapy. It works. It helps. Coupled with other things, as mentioned, your massage. You mentioned something really important too. If we're dealing with aches and pains, it's hard to sleep, right? But the moment you begin to relax the body and reduce pain, now I can sleep. Ladies, that is the big connection. The feel better. Yep. The feel better, do more. It's real, right? The moment we are managing stress, and when we talk about pain management, pain is stress to the body. So at the end of the day, it just all goes back to how are we managing stress the best way we can. When we do that, then naturally things like sleep will begin to happen. We will feel it. So it's been a great evening. You have to commend yourself. Give yourselves a round of applause for setting aside this Monday night. I know there's I will throw this challenge out to everyone on the call. You too, Erica. I know we were supposed to connect. We have to connect because the year is winding down. We are literally getting down to the last couple of weeks of 2023. It's the beginning of the month. Every week we have goals, but I would love to be able to touch everyone virtually on this call, individually on a one-on-one, whether it be a 5-minute phone call, whether we decide to do a few minute Zoom and talk about what your goals are, right? We don't want the festivities of what's coming up, or this idea that January is a new month, it's a fresh start. All that stuff may be real. But at the end of the day, I always feel like anything I'm working towards, I don't have to wait for a date to work towards it. I can start making those small steps now. So what I challenge you all to do is think about, as the year winds down, we have just a little over 3 weeks left, in my opinion, because today is the 4th, barely 3.5 weeks left. What is your goal? How are you closing out 2023? What is your goal over the next few weeks? How realistic is that goal? But how great will it feel to do what you can in order to work towards it, accomplish it, so that at the start of 2024, all you are doing is continuing on that same journey and that mission to accomplish another goal with even more confidence. So let's aim to do that. It's only the 4th. Our physical office is closed tomorrow, but we have meetings planned and scheduled, which means we will answer the phone and we will respond to email as well. But let's make it a plan to not let this week go by without doing a touch base, becoming goal-centered, and seeing what we can do collectively. Me as an advocate, nudging you along the way,
to help you reach this goal that you have set by the end of the year. So I thank you all for hopping in. Unless you have any questions, continue in this journey, find that focus, and please let's not let the week go by without our connect. Take care and make the rest of your week a wonderful week.
Thank
Good night, everybody.
you.
Stay
Good
safe.
night.
Thank you. Good night. Thank you.